So, healthcare literacy is a patient's ability to obtain, process, and understand basic information and services that are available to them to make sound decisions about their own health and any interventions they may be taking with their health. So, this includes reading and math ability, but it also includes the patient's ability to interpret instructions, both written and verbal, and their ability to interact with the healthcare provider that they're seeing, so that if they can ask questions and get answers, raise concerns that they may have about any treatment interventions or medications that they're on. And overall, this is the patient's ability to navigate the healthcare system. A third of individuals in the United States have low healthcare literacy rates. Um, and going along with that is patient education. So, to help combat low healthcare literacy rates, we need to make sure that patients are being educated according to their literacy level. The education should be an active process from all healthcare professionals, and it needs to be patient focused first and foremost. Um, there needs to be open communication between the healthcare professional and the patient. If there's a caregiver involved, then there is also communication with the caregiver or parent, both between the patient and the caregiver, as well as between the healthcare professional and the caregiver. Um, these this needs to be a two-way street for communication. Patients need to make sure that they can interact and ask questions with the healthcare professional, as well as get appropriate responses from the healthcare professional. So, with patient education, um, the all the materials that are used should have brief instructions that the patient can understand. So they need to be between a fourth and sixth grade level of reading. There needs to be images with it, and there also needs to be it needs to be information that is needed to know, not information that is nice to know. So all the information that's included, it needs to be pertinent to that patient that's being treated. Um, there have also been several pamphlets that have been created that for individuals who may not be fluent in English, it can have side by side languages so they can switch back and forth between Spanish and English, and just to help increase their understanding of what they're being told in a physician's office. And telemedicine is also a strategy that can help improve both healthcare literacy and patient education. And this is basically using electronic devices to help improve healthcare and help improve patient outcomes. It can be anything from phone calls from the doctor's office, following up with patients, or setting up appointments, as far as doing online evaluations. There may not be a specialist in everyone's immediate availability, so if need be, a patient could be seen by a physician in a completely different state, by using telemedicine and having a virtual appointment. So all of these methods can help increase patient outcomes. And it can also make it easier on the patient to have more immediate access to their records and have some interactive ways of tracking their progress that they've made, inputting their own personal information in, and getting feedback from physicians. So connecting all these ideas, there needs to be an understanding that there's a social link to molecular disease. So if an individual has a chaotic or difficult circumstance, this can lead to an increased risk of health problems. So children who are raised in a chaotic environment can increase their stress, which can lead to a reduced ability to learn. if a child has a reduced ability to learn, this sets them up for poor healthcare literacy as well as struggling to understand patient education materials. So we need to combat this by improving our patient education and helping patients improve their healthcare literacy. So using these methods, we can focus more on a salutogenesis idea instead of a pathogenesis treatment plan. Pathogenesis is the identification and treatment of diseases, where salutogenesis is focusing on the wellness of an individual. So if we can improve the wellness or remove factors that would decrease wellness, then in turn we're reducing the likelihood that that individual has disease. So switching this focus can help improve all three aspects. And patient education and healthcare literacy really do go hand in hand. You can't have one without the other, really. While patients should be educated according to their healthcare literacy level, those patients that are more literate and more well educated won't be offended by having a simplified version of any patient education handouts. And again, if we can include electronic forms of education or communication with the patients, this is also going to help. In the end, we need to make sure that we're our patient's biggest advocate, especially being in a athletic situation, an athletic setting. We deal a lot with patients that just get led through the healthcare system. So as athletic trainers, we need to make sure that we are providing appropriate patient education to our patients, but we also need to make sure that that patient education includes navigation of the healthcare system, that patients can, after they're no longer an athlete, that they know how to set appointments, that they know how to navigate the insurance system. So we need to make sure that we're setting up our patients for success when they are no longer being guided through the system.